Well, I mean, as our title says, we're looking for the community to have clear health communications. So we used to be called the Health Literacy Initiative, which makes sense in the community that we're in, but for the layperson, that doesn't make any sense. And so what we're really driving at is to make sure that the people in healthcare profession are better able to explain the products and services they have in a way that patients can actually make good choices. Because if they don't understand what they're trying to do, then how are they going to make a good choice? And so it really comes down to making things simple for everyone to understand. Because as you can imagine, if you get a serious diagnosis, you're going to have some trouble really understanding what's happening, no matter what your background, your education, your abilities. So to make it a simple communication for everyone then just brings it at a set level so that we can make better choices.
So I'll add that high literacy rate does not equate to a high health literacy understanding. So we try to debunk that as often as possible so people understand that we have to take into account somebody's background, not just their education level, maybe social determinants of health. All of that can impact somebody's ability to receive and give information. And what's nice about the training that we do is that it's very inclusive as far as like meeting people where they are, and it's available for rolling out on a wider basis, and people can go deeper into the subject matter. Tom was talking about some research that we did with Seton Hall University, some business students. We worked with Black women in clinical research to see specifically what are the reasons that they get into that industry, what is missing from their communication through line in the industry, and what can be improved. So when we talk about diversity in clinical trials, it's not just participants in the trials themselves, but it's who upstream gets involved in the whole process.
And maybe if I could add to that, what's interesting is we looked at the communications between the physicians and the patients as well. And if the physicians make an assumption of what level of health literacy the patients have, they may then tailor their discussion thinking, oh, well, this is a professional or even have a medical background. They may use higher level terms, get much more complex at first, when in reality what you should do is start with a very basic level of understanding for everyone, and then afterwards you can always tailor it if they have additional questions. So that was some of the work we did as well.
So we introduced health literacy training with the facts and figures about the fundamentals of health literacy, but also how they can translate that information into actions and strategies within their own companies, within their own community, and elsewhere.
So we had a very good training this morning where everybody in person got to learn about the different health literacy principles, and then they took a quiz so that they could actually get certified in health literacy and market research that they could use. You can put it on your resume, you could post it on social media, and of course you may have missed coming to the Institute for that, but however, we actually have an upcoming webinar that you could also participate, and if you take the quiz and pass, then you would also get certified. Eventually it will become part of the membership and you can access it on demand. So there are a lot of things that we're focused on. We're trying to keep everything to our core mission of making communication simple. First is education and training, so that's kind of what we did at this institute as well as what we're going to be doing probably again through webinars. The second thing we're trying to do is to look at how when you're trying to have clinical trials, obviously if people don't understand what it's about, then they may be hesitant to get involved, especially if they're from a minoritized group. So we're trying to make sure that people understand the best way to communicate what the benefits are and why it's important. We're also looking at English as a second language because, for example, I was recently in the ER with a family member and the person didn't speak English. So then they had to make sure they had the resources to explain, understand what their problem was, what their choices were so that they could get the proper treatment. And then finally, we would love to partner with someone where we could show an outcome in healthcare based on having better communications. So, for example, in our original research, we showed that if you can make things simpler to understand, people have a better understanding of what their choices are. But we would love to show that that actually translates to a better health outcome. I mean, we're always looking for more members to get involved. We are very flexible in how much time you commit, so people, ebb and flow on how much they dedicate. One of the biggest things we're trying to do is to show that health outcome based on using some health literacy principles, And so we're looking for manufacturers or even pharmacies to help partner with us to show that final health outcome goal, so that we can show that it is true that when you make certain changes in the written materials, that people actually have better outcomes.